An interesting legislative battle going on right now, and joining us to talk about this is the chief of ophthalmology over at Texas Tech, Dr. David Lloyd McCartney, joining me here on the Chad Hasty Show. And Dr. McCartney, welcome to the program.
Good morning, Chad. Thanks for having me.
Absolutely. Appreciate you taking some time today. Tell our listeners a little bit about a battle that's going on that maybe they haven't really heard about.
Well, it's quite possible, Chad, because it's sort of a special interest thing. There are actually 3 bills in the legislature this year, and all 3 of them attempt to give additional privileges to optometrists that are really privileges that require medical school education at the present time. One of those bills also gives surgical privileges, and obviously those of us who are actively involved in education of physicians and teaching them these skills are concerned for the safety of Texans.
Well, what is the concern surrounding exactly?
Well, it's really a very simple one. The whole business of regulating medicine has to do with trying to protect the public from practitioners who don't have the education to actually do the things they might propose to patients. So it's really about patient safety.
And what does, for those who are hearing about this for the first time, how would it affect the average everyday citizen out there, and why would it be a big deal?
Well, let's say that the worst of these bills got approved, which essentially allows optometry to do all of glaucoma treatment unsupervised without consultation with ophthalmologists and a number of surgical procedures. At the present time, these things are illegal to be done in the state of Texas and in most states across the country. So since optometrists are educated by other optometrists in optometry school, they're not getting any education in this. So to suddenly certify them as capable of doing these things has great concerns for safety, and these experiments have been tried in other states. There's a recent example in Northern California where the Palo Alto VA discovered that against their own regulations, the optometry clinic was in fact treating veterans, and a number of those veterans lost vision permanently. And they've changed their practice since then, but this is what's being proposed to be done now in Texas.
Why the changes?
Are you asking the motivation for these bills?
Yeah.
Wow, Chad, that you're asking me to be a mind reader, I guess. But honestly, it's probably pretty complex. I think there are some business pressures that have come to bear, but I think the reality is I have a number of optometry colleagues. I work actively with 5 here at Texas Tech. They all practice within their reasonable scope, the scope of practice for which they were educated in. And really, I see these bills as kind of a small fraction of the profession who I would say are kind of radical, almost, I hate to say white-collar terrorists, but it's really a radical fringe element that is pushing, in the long run, equality. They want parity of certification and licensure without parity of education. And this is just incrementalism. This is just part of that whole long-term multi-year strategy.
Well, I was wondering, is this something that a bunch of optometrists want?
Well, it's a complicated issue. I think I certainly have talked to them. We've seen a series of these bills over the years. I haven't talked to anybody this year, but in previous years, I've had a number of people say, I don't want to do that stuff. I'm not trained to do that. Mm-hmm. But it's kind of like a team sport issue. If you ask the average optometrist on the street, I think they'd be favorable towards this because they see it as financially, potentially promising to them, and they see it as something that achieves more parity with ophthalmology.
Interesting. We are visiting right now with the chief of ophthalmology over at Texas Tech, Dr. David Lloyd McCartney. Do you know where these bills stand right now in the state legislature?
I'm sorry, Chad, I actually don't. I think they're in committee, but as of today, I'm not sure.
Well, it's one of those where if they are still in committee and there's not a lot of momentum, you're kind of counting down the weeks right now to where they may not even be heard.
Well, except that there is some real interest on the lieutenant governor's part, and they're trying to sort of rope this whole concept in with the so-called free market push in the legislature, which is getting a lot of play this year. So it's a little unpredictable.
Very interesting. Well, we'll continue to take a look at it. I appreciate you giving us a call today and making the listeners aware of some of the bills that are going on out there in the legislature.
Well, Chad, if folks are interested, they should go to TexansForSafeSurgery.org. There's an action link there, and there's lots of information that would clarify some of the things they might have heard today and didn't quite understand.
All right. Very good. Dr. McCartney, appreciate your time today.
Thank you, Chad. Always a joy.
Have a good one.
All
All right,
right.
770-5790, toll-free, 1-800-687-0790. Yeah, that's just some interesting bills that you may not have heard about, whether you agree with them, disagree with them. There's a lot of those type of bills out there that they get absolutely no play in the media. And, it's one of those where right now, I still go back to if it's not moving, if it hasn't been heard yet, folks, they don't even have a budget yet down in Austin. And a lot of these type of bills that aren't getting a big push may not even be heard. But it is interesting to know what is being debated down in Austin and to see where some of these pieces of legislation go.